Men and women experience significant differences in heart health, including variations in risk factors, symptoms, and disease presentation, which can impact diagnosis and treatment. Joining me in studio to tell us more about the differences are nurse practitioners Sarah Hendricks and Brittany Cox with WVU Heart and Vascular Institute at Camden Clark. Ladies, thank you so much for sitting down with us again this week.
Absolutely.
Yes, thanks for
We're happy to be here.
Of course. So the first question that I want to talk about is heart conditions between men and women. It's a little bit different, and there are things that aren't so obvious for people to see. Can you tell us a little bit about the different conditions that men may face versus women, and also just some of the not obvious signs that people should look out for?
Yeah. So women often don't have those classic textbook symptoms that you might read about. You know, men and women do differ quite a bit in some symptoms that they can experience. Women often have maybe not that classic chest discomfort. It might be a discomfort, but maybe not a pain, and maybe it's less severe. And they may just check it up to having stress or anxiety and just more often they might experience shortness of breath, maybe nausea. Maybe they would feel like a discomfort in their jaw or in their neck, maybe into their back, or maybe like a band-like tightening around their bra line. So women do experience that kind of thing where men often have that more classic elephant sitting on the chest, you know, breaking out in the sweats, nausea, vomiting, shortness of breath, those kinds of things. Fatigue is also really big for women as a complaint.
Okay, and are there any signs that, you know, maybe, like, some of those can definitely not be as obvious, but are there any that are just so excruciatingly, like, unobvious, things that we can be unaware of so easily that on everyday basis it's something that we probably should be aware of?
It definitely can happen. So, and you know, they used to think of coronary artery disease as a men's illness, right? Women, so women were just vastly underdiagnosed, and so we know that's not the case, but because women don't always have that, like, crushing chest pain, you know, so, and women, we, because as myself, I'm a woman, but we tend to think of ourselves as like the caregiver, right? So we don't always speak up about our symptoms. So it's really important to know that not everybody is going to have that crushing chest pain. If you have a symptom, if you feel like something's wrong here, something feels different, it's worth speaking up to your provider and saying, I think that I've got something going on. If it's severe, please go to the emergency room and get checked out. You only get one heart. You've got to take care of it. If you are very concerned that this might be your heart, if you've got those feelings like something is wrong here, go. Diabetics can have different symptoms. Diabetics can have different pain tolerances and different, so they don't always have that chest pain symptom. So if something feels different, if you're not able to, you know, do your day-to-day activities like you typically would, if you feel like you just have this overwhelming sense of fatigue when you're exerting yourself, things like that, get checked out. If it's severe, go to the nearest ER.
I often will tell my patients, if it's something that you could do easily a month ago and you can't do that same amount of physical activity now, that's a change.
Definitely a good tidbit of advice, I think, to give your patients. Now, this leads me into my next question, because you're talking about your patients. So when someone needs heart care, what role do you play versus a cardiologist in treating or caring for those patients?
So within our office, we have a very team-based approach. We have several cardiologists, we have several APPs, advanced practice providers, nurse practitioners such as myself and Sarah, as well as physician assistants. And so if a patient needs an appointment, say for preventative treatment or because they are having symptoms and they come in to see one of the APPs, we can assess the patient, we can determine if any testing is needed, you know, depending on, are we looking at preventive measures, are we doing that blood work, those preventative studies, are they having symptoms? Do we need to do a stress test to check for a lack of blood flow? Do we need to do an ultrasound to make sure their heart valves look good? Different things like that. We can assess if they need a medication for their condition. We can prescribe medications, and then we also collaborate with the cardiologist. So if there's once their test results are back, or even if we have some questions in regarding to their assessment that we've seen, we take that to the cardiologist. And if for some reason they need advanced testing, they need a heart catheterization, something like that, we will arrange that with the cardiologist. They'll be scheduled. So we work very much just an extension with them. We are a team. We work together very closely.
Right. And so what would the normal chain of events be for someone that is determined to have heart issues from, say, an EKG to a stress test or maybe a cath lab?
So let's just take a scenario where maybe a patient goes to see their primary care physician and they're having some abnormal symptoms, maybe some chest pain.
Right.
Let's say the PCP does an EKG and the EKG looks a little abnormal. So they get them over to our office. At that point, would either be seen by the cardiologist or one of the APPs in our group, and would have a full evaluation, assessment, and would likely go on for some further testing if there were some abnormalities there. So that might include a stress test, which would help us to look at blood flow or maybe lack of blood flow, maybe some old damage with some imaging. We would be able to see that. If that was abnormal, then it may lead to further evaluation, and that might include something more non-invasive, like a coronary CTA, which is like a CAT scan. Technology is wonderful, and we're able to really,
it's come so far.
Yeah, we're really able to define the vessels in the heart and be able to identify blockages that way. Some patients may not be the best candidate for that, and it might require a cardiac catheterization. So the cardiologist would take the patient and perform the catheterization, either going through the wrist or the groin, and taking a look in those vessels, trying to see if there is a blockage, and if so, try to open up that blockage, intervene on that blockage, and restore blood flow. Yep. So that's one scenario.
Perfect.
Yeah.
And Brittany, is there anything you wanted to add to that portion too?
That would be truly, that's a scenario we've seen take place. You know,
Right.
a patient has symptoms, they start with their primary care, they come to our office, testing is ordered, and then determining their treatment plan, we just continue to progress to hopefully help them have the healthiest heart possible. So
Absolutely, and that's the most important thing, having that
Absolutely.
healthy heart. So to wrap up our 2 weeks of our health check, talking about heart health, can you kind of share maybe a final takeaway with the viewers on the most important things about our own heart and how to stay healthy?
Absolutely. So I think the biggest part is, you know, the things that you can change, the lifestyle modifications you can make, you got to make them. You got to put your heart first, you know, but you can start small. Smallest changes can make a huge impact.
For sure.
You got to have regular visits with your providers, be it the cardiology office or just your primary care. You have to make sure that you are taking care of your heart because you're the one person that can. So, yep, it is your responsibility, so make it a priority.
Absolutely. Sarah, anything else from you too?
No, I agree. I think even small changes today can make a big difference for your heart in the future.
Absolutely. Well, ladies, thank you so much for sharing your wealth of knowledge on the heart and heart health with us. We appreciate it all here, and we hope to see you again soon.
Thank you. Thanks for having us.
Of course, when we return Mid-Ohio Valley, we'll have one last look at your forecast. Stay with us.